From the start of the pandemic, people with disabilities have been left out of the conversation for fighting the coronavirus. People like Aisha Ghazi Edwin, who lives with vitiligo, an autoimmune disorder.
It's terrifying. I mean, right now we see mask mandates dropping and we see some of the restrictions rolling back, but people with disabilities are still dying at disproportionately higher rates.
She's also the deputy director for Detroit Disability Power, a disability advocacy group in Metro Detroit.
It's beyond disheartening. It's extremely tragic, and we see it in everyday people's lives.
In the U.S., 61 million people are living with disabilities. In Michigan, it's more than 2.3 million, or just under every 1 in 3 people. Those disabilities come with other risk factors. They're more likely to have other health issues. They're more likely to live in group settings. They're more likely to have lower income because they need extra medical care, which also means they're more likely to be in and out of hospitals or receive home care.
All of these groups are already vulnerable and already marginalized. But if we put a pandemic on top of it, it's a matter of life or death.
But there's one big problem. Even though they know the risk to people with disabilities, the Michigan Department of Health and Human Services don't have any data on its COVID dashboard about them. No case numbers, no hospitalizations, and no total for how many people with disabilities died from the virus, leaving advocates, families, and those with disabilities in the dark about how to deal with COVID. It's not just Michigan either. The federal government doesn't appear to know how many people with disabilities got sick or died during the pandemic. The CDC only releasing publicly the number of vaccinations for those with disabilities, but that's it.
We need to start capturing data around people with disabilities because there's a disparity and we need to know how to close it. And we need to incorporate that knowledge into our, public health directives and our mitigation efforts. We haven't seen it happen yet. We're not entirely sure why.
Without that data, we don't know what adjustments need to be made, what corrections may need to be made. And honestly, we're going to be looking at how people are living with the long-term effects of COVID, and we want to sort of collect that data as well.
The state was also warned about these failures. In late 2021, the state's own Civil Rights Commission sent a letter to the governor, the lieutenant governor, and the state health department saying the data for disabilities was vital, saying the ongoing COVID-19 pandemic has highlighted the inequity that people with disabilities face, and MCRC urges MDHHS to prioritize the capturing and reporting of COVID-19 disability-related data at the state level. But it never happened. And that could mean more problems as the pandemic shifts again, especially when it comes to the civil rights of those with disabilities.
We're very concerned, but more so we're being proactive, right? There's two kind of roads here. There's how COVID affects people with existing disabilities. And then there is the road of how does long COVID play out, which means that it's going to be creating a whole host of other new people with disabilities.
Local 4 asked MDHHS why they were tracking other federally protected classes like age, race, and sex, but not disability. In an email, a spokesperson saying, "It is not collected consistently enough during case investigations to have reliable data through the Michigan Disease Surveillance System."
And I think that's what's so important, that we just recognize that where there were gaps or where there are gaps, that we are trying our best to make sure that those gaps don't exist going forward.
More than 2 years into a global pandemic, and still gaps remain for those who too often fall through the cracks.